Welcome back to Politics Tonight, everyone. Thank you so much for staying with us. Tonight, our focus is on National Health Insurance Authority, and I've been speaking with the Director General, National Health Insurance Authority, Dr. Kelechi Ohiri. Dr. Ohiri, thank you so much for staying with us. So, as you've said before we went on break, the NHIA addressed some of the shortcomings of the previous NHIS, but one major challenge that may hamper effective implementation is shortage of healthcare workers, as well as problems with enforcement as it mandates all Nigerians to enroll. Talk to us about how these constraints will be surmounted to ensure the Act accomplishes its aim.
Thank you very much. Thank you very much for the question. There are two elements to the question you asked. I think the first is regarding how well we enforce the mandate. And then the second is about, the health workforce. And it's not just the health workforce in isolation, it's the health workforce in the context of service delivery overall. In terms of enforcing the mandate, I think we have to take a lot of proactive measures to do this. As you know, as applies in other sectors, right, compliance requires enforcement. It means that we need to ensure that companies do not run afoul of what the regulation says. And one of the ways we are doing this is, first of all, we are establishing what is called the mandatory minimum. So what does it mean to be covered? It's not enough to say, I have staff and when they are sick on premise, they have health care. And when they are sick at home, they don't have health care. Nor is it enough to say that people are covered only when they have malaria and typhoid, but if they have hypertension, maybe they are not covered. Or to say that it's enough to just cover a woman when she delivers, and then once she leaves the hospital, then she's no longer covered. So one of the things is to enforce something, you must have standards set. So we're setting standards by defining what that mandatory minimum is for you to be in compliance. And secondly, we will begin to require demonstration of evidence of that compliance as time goes on. So watch the space. We will come out with very clear guidelines, very clear policies on what it means to be in compliance with the mandate of the law that says that you have provided adequate health insurance. We also want to make it easier for people who want to sign up, and there are programs that have been set up in that regard. And we're currently working with our teams and our state counterparts, as well as the private sector, to look at schemes where individuals and groups can actually sign up for health insurance, because we have increased awareness and we have informed people of the virtues and the benefits of financial protection from the costs of healthcare. Now, with regards to the issues around health workforce, it's a major challenge that we are seeing, and this is being addressed in multiple ways. Well, first, there is a range of activities in the health sector that is currently underway to ensure that we train, we retrain, we expand capacity to train very critical healthcare workers, nurses, midwives, community health workers, and even doctors, so that we can train them and actually retain them, including incentivizing such. Also, from our perspective, we want to make sure that by the time we provide the adequate financing, either through the appropriate tariff to hospitals are able to plan better. Hospitals are able to retain workers and pay them better. So from the demand side, ensuring that you have good quality services is also a critical part of sustaining a system. And like I mentioned, it's going to take multiple hands to be on deck, on both the supply side but also on the demand side. And I think a lot of activities have started and a lot of initiatives are underway to ensure that Nigerians have access to good quality healthcare that is provided by the right cadre of healthcare workers overall.
Impressive. But Dr. Ohiri, you and I know that a major setback to health insurance scheme in this country is poor financing. Is there a likelihood that government will inject more funds into the system? Is that a well-laid plan to pool resources?
Yes, there is a likelihood that government is injecting. I think one of the things that we need to be proud of in Nigeria is the Basic Healthcare Provision Fund, right? And this is not just a one-off investment. It's an investment in perpetuity towards primary care, which is still one of the best buys in healthcare in general. And so ensuring that we have consistent and continuous funding make sure that our primary healthcare centers are service ready and can provide the necessary set of services. And for the window that goes through the National Primary Healthcare Development Agency, some of that money goes into the health workforce. Some of it goes into ensuring that we have the right commodities, drugs, and consumables. And some of it goes into ensuring we have the right infrastructure. On the demand side, it's about building the platform for health insurance to cover the poor. But beyond that, the government also in the budget for 2024 put additional resources for the Vulnerable Group Fund. So these are additional resources that the government has put in place. Now, we're a population of 200 plus million people. So is there room for more financing? Absolutely, there's room for more financing. And what we're exploring now, what are the other innovative financing mechanisms we can use to mobilize additional fiscal space to healthcare. And then lastly, what I'll just say to your excellent question is, it's important to have more money to address the issues, but it's also important to ensure we have more value for the resources that we have. And we have more value by being more efficient with the way we manage our resources, more value by ensuring that the things that we are actually addressing are those things that matter the most, those things that contribute to reducing mortality, particularly maternal mortality and child and under 5 mortality. So by being very targeted, by prioritizing what we call the best buys in global health, we're making sure that we're getting more value for the limited resources we get, while we continue to advocate for and continue to work at all levels to increase the mobilization of additional resources from the government to healthcare in Nigeria.
So talking about looking out for more money, are you looking out for voluntary donors, or what exactly are your revenue generation methods?
Thank you very much for that. If you look at the Basic Healthcare Fund and the Vulnerable Group Fund, it talks about funding from multiple sources. Of course, you know, and different funding sources have different characteristics. The best being the one that is sustainable over time. But nonetheless, we're looking at fiscal space enhancing measures. So there are many options on the table, including voluntary contributions from development partners, from the private sector, from charitable organizations. Yes, that goes, you know, a long way to helping alleviate some of the fiscal challenges. But that's not enough. We need to look at other countries have tried many things. Some countries have put in place things like sin taxes. Some countries have taken part of VAT to finance health insurance. But these conversations cannot be had in isolation. They need to be discussed within the framework of fiscal policy with the Ministry of Finance to look at the need to expand fiscal space for health as an investment in human capital development overall. And these conversations are being had by the Coordinating Minister of Health and Social Welfare and the Minister of Finance when we look at the Human Capital Development Program and when we look at, you know, the case for additional budgetary allocations to health and also other innovative financing mechanisms that we can channel towards healthcare. So a lot of options are on the table, and the intention is to work all options to see in the context of our macroeconomic realities and macro fiscal challenges what option we want to look at. But I would just tie that back as well to the efficiency conversation, because efficiency of spend is actually one of the more frequently overlooked abilities to generate more fiscal space to invest in health. And looking at how we manage our finances and what we target them at will go a long way to increasing the value that we get out of a limited fiscal envelope. But all options are on the table.
All right. I mean, I asked that question because I know for a fact that implementing a mandatory health insurance scheme for all Nigerians will require a lot of resources to carry out its activities, such as awareness creation and education. So, Doctor, how much advocacy has gone into making sure Nigerians know the importance of this? You would agree with me that widespread continuous publicity of this NHIA is necessary.
No, I could not agree with you more, to be honest. And we need to do more. We need to create more awareness. And people need to understand not just about NHIA, but about understanding their options for financial protection. We have a situation where a lot of people, roughly 70% of people, pay out of pocket for healthcare. Some of them may walk to a pharmacy and buy a drug. And in some cases, they're actually spending much more than what a premium contribution to a health insurance program would have been. And had it been that they paid into and subscribed to a health insurance package, they would have that index illness or ailment as well as others covered. So there's a reorientation that is needed. There's an education that is needed. And also there's more awareness that must be created so that people are aware. There's a cultural element about how we construe or view insurance that also needs to change. And part of this, as you mentioned, is one of the things we need to do. And I think our work is cut out for us, but not just the NHIA, but all stakeholders involved in health insurance, but also involved in financial protection and access to healthcare. If Nigeria is to get to universal healthcare coverage, it means that not only should the NHIA do this, but also all of us as a collective need to continue to advocate, and we need to continue to educate and inform all Nigerians about a better way for financial protection from what could be catastrophic costs of healthcare.
Yeah, so Doctor, I wanted to know how you intend to educate and inform them.
Thank
you. Are you partnering with media organizations, CSO, what have you?
Oh yes, I mean, we are fortunate to have a lot of non-governmental organizations, civil society organizations that have been on this journey from inception. There was a landmark universal healthcare coverage conference in 2014 that was a precursor to the National Health Act. So we are literally standing on shoulders of lots of advocates who have, over the years, been advocating for universal health coverage, and we will continue to partner with them to ensure that information is spread. We'll partner with the media as well, because the media has a pivotal role in ensuring that Nigerians are educated about this, that there is enlightenment about this, and that, you know, we continue to create this awareness for people. And so civil society, the media, all insurers, public and private, whether it's HMOs or government-run, state government-run schemes, are people we will partner with to ensure this. In addition, we have lots of NGOs and development partners that are particularly exercised by this, and we see them as allies in this journey to continue to educate people. This is not to absolve the NHI of its as being primarily responsible to promote health insurance, and that's one of the things that the Act has mandated us to do. And we will continue through advocacy, through engaging with the media, through working with all the providers, to enforcing the mandates where required to ensure that we use all the tools at our disposal to get the word out and to also get people to comply with this.
All right, so let's quickly talk about improving and harnessing private sector participation in the provision of healthcare services. Another concern with this group is that they usually have this a lower willingness to participate because of the unpleasant experiences that have been encountered by those who ventured into the previous scheme, particularly in the aspect of receiving payment from HMOs. How do you intend to address this?
Thank you very much. You're right in the sense that experience has sometimes been mixed. And if we look at the model that we speak about, you have private providers, you have HMOs as, sometimes strategic purchasers of care. And oftentimes it's a dance between trying to contain and manage costs and also while ensuring that the quality of care for the patients is not compromised upon. And one of the things that we've done, and I think I mentioned earlier, our enforcement team does, is that whenever these issues arise, it is one that we take seriously, and in many cases we arbitrate and we intervene and we investigate to see what the issues are. Where the case is that the HMO is not is at fault, we take necessary actions, and in some cases it might be the provider, and in some cases it's the macro situation that requires a review of many things. For instance, we know that medical inflation over the last couple of months and a year has actually, gone higher than expected and actually outstrips, inflation. And so one of the things we have put in place there is to actually go back and do actuarial analysis and costings to understand what are the true actuarial costs of providing the same minimum basic package of services. In doing so, as a regulator, we can determine what the appropriate cost of services will be, what the appropriate premium or what the appropriate tariffs are, and that makes it easier to enforce. It might mean an upward revision of tariffs, and in that case, some of these issues that are as a result of just rising costs for the same benefit package will be addressed. In other instances, where it is where care is being denied or there are issues between the different parties, we will continue to investigate and continue to make sure that the patient and the customer, the person, doesn't suffer. And that for us is redesigning the way we work to make sure that the enrollee is the center of what we do. And so, and under every circumstance, we want to make sure that that is protected. Sorry,
all right, let's
go ahead.
turn to benefits and bonuses for healthcare workers. What welfare packages are available for healthcare workers and other human resources that are willing to work in remote and rural areas, as well as ensuring the provision of basic infrastructural facilities in these areas?
Thank you for that question. I mean, I think my colleagues who are running primary healthcare agencies will probably be in a stronger position to address this, but I'll just add 1 or 2 points. I think we have realized that retention is a critical issue. And one of the ways that under the BHCPF, for instance, we're looking at it is looking at performance-based incentives and financing through what is called the direct facility financing, where those particularly in hard-to-reach areas, when they meet certain performance targets, have additional resources allocated to them. And those resources will serve as incentives to actually continue to sustain or boost productivity. And those are resources that can actually be used to augment what they earn, but also ensure that investments can be made at the facility level. It's almost a decentralized way of making sure that the morale of the health worker who's working there is improved, and in that case, enhance retention of the health workers. So that has been articulated by the MPHCDA, and is one that we are buying into, because, for instance, in such facilities that provide such services, we are ensuring that we partner with MPHCDA to accredit facilities that are of good quality and provide those services. So if you're receiving funds through capitation for enrollees who go there, and you're receiving additional incentives for providing and meeting certain service indicator targets, then there are financial incentives that will encourage you to continue to deliver.
All right.
And this is targeted to some of the areas where that unfortunately are hard to reach, but unfortunately that's where we have some of the highest, maternal and infant mortalities, and that's a priority for us.
All right. Thank you so much, Doctor. It's been a great pleasure speaking with you this evening. I've been speaking with Dr. Kelechi Ohiri, is the Director General, National Health Insurance Authority. Tonight we focused on National Health Insurance Authority and all the benefits that comes with this act. Thank you so much for joining us on Politics Tonight.
Thank you very much for having me. It was a pleasure speaking with you.
And thank you very much for watching. That marks the end of today's episode of Politics Tonight. But the conversation continues from here. Get in touch with us on X at TVC News NG and at Olajumoke using the hashtag Politics Tonight. We're also on YouTube at youtube.com/TVC News Nigeria. I am Olajumoke Olatunji. Good night, everyone.